Hello, my name's Christy Martinez, and this presentation is on leprosy. Leprosy, also known as Hansen's disease, is a chronic bacterial infection. It's a slow progressing disease primarily affecting the skin, peripheral nerves, mucosal membranes, and eyes. The infection is curable but can cause permanent disability if untreated. Early detection remains essential to prevent complications and transmission. This presentation provides an overview of its epidemiology, pathophysiology, diagnosis, and management, while also highlighting the significant role of advanced practice nurses in patient care, education, and advocacy. Globally, leprosy remains a public health concern, particularly in countries such as India, Brazil, and Indonesia, which account for the majority of cases. There are around 200,000 new cases reported each year throughout the world. There has been a gradual decline of new cases, with most countries reaching elimination standards in 2010. Although the United States reports only a few hundred cases annually, awareness is vital due to potential transmission through contact with armadillos and travel-related exposures. Mycobacterium leprae primarily invades Schwann cells, leading to demyelination and nerve damage. Transmission occurs via nasal droplets after prolonged close contact, and the incubation period ranges from 6 months to 10 years. The host immune response determines disease type. This can range from tuberculoid, which shows a strong immune reaction and few lesions, to lepromatous, with a weak immune response and diffuse infection. The clinical presentation varies from mild skin lesions to severe deformities. Patients often exhibit hypopigmented or reddish patches with sensory loss, nerve thickening, and muscle weakness. Untreated cases can progress to claw-hand deformities, foot drop, and ocular complications. This highlights the need for early recognition. Diagnosis is primarily clinical, supported by laboratory confirmation. Slit skin smears can identify acid-fast bacilli, while biopsies demonstrate granulomatous inflammation. Polymerase chain reaction, or PCR testing, is increasingly used for definitive diagnosis and classification into paucibacillary or multibacillary forms. Leprosy is curable through multi-drug therapy, or MDT, as recommended by the World Health Organization. The standard regimen includes rifampicin and dapsone for paucibacillary disease and the addition of clofazimine for multibacillary forms. Corticosteroids may be used to manage nerve inflammation, and physical rehabilitation supports functional recovery. Complications such as nerve damage, blindness, and chronic ulcers can lead to lifelong disability and social stigma. The most severe complications stem from the peripheral neuropathy. This can cause a loss of sensation, including the ability to feel pain or temperature. Repeated injuries can lead to loss of fingers and toes. The muscle weakness can lead to deformities such as foot drop and clawing of the fingers. Prevention centers on early case detection, contact tracing, and prophylactic single-dose rifampicin for contacts. Health education is crucial in dispelling myths, preventing the spread, and promoting social reintegration. At the population level, the World Health Organization's global leprosy strategy aims to eliminate disability through early detection and community-based rehabilitation. Despite progress, stigma and misinformation remain barriers to care, emphasizing the need for continued public health outreach and culturally competent education. Advanced practice nurses play a pivotal role in managing leprosy through clinical, educational, and advocacy domains. They provide holistic patient care, monitor treatment adherence, and manage complications and disabilities related to leprosy. Advanced practice nurses also educate patients and families and help to reduce the stigma and misconceptions of the infection. They also advocate for policies that ensure equitable access to health care. Their leadership supports evidence-based practice and helps dismantle social stigma. In conclusion, leprosy remains a global health issue that is preventable and curable. Early detection, appropriate treatment, and stigma reduction are essential. Advanced practice nurses are instrumental in implementing these strategies through direct care, advocacy, and education. Continued collaboration with global initiatives will help to sustain progress with the elimination efforts. This concludes this presentation on leprosy. Thank you for listening, and here are the references that were used.